right, good morning and welcome. I'm Vanessa Hoffman, Education and Research Manager at Bladder Cancer Advocacy Network. This morning we present Be Heard, Join the Patient Survey Network. I'm going to do some quick housekeeping first. You have the option of listening to this webinar either using your telephone or microphone and computer speakers. You should see the phone number to call. You should also see a questions box on your GoToWebinar panel. Type your questions in that box as you think of them, and we'll get to as many questions as possible at the end of the webinar. This webinar is being recorded and should be available within the next 2 weeks on the BCAN YouTube channel. If you have technical difficulties, please call Citrix GoToWebinar tech support at 888-621-0537. The number is also on your screen. Now I'd like to introduce our distinguished speakers. We are lucky to have the project lead and co-lead for the Patient Survey Network project here with us today. First I'll introduce Dr. Angela Smith. She's Assistant Professor of Urology at the University of North Carolina, Chapel Hill School of Medicine. She also received her medical degree and completed her urologic residency there. She's a member of the UNC Lineberger Comprehensive Cancer Center, where she treats genitourinary malignancies, including bladder, prostate, kidney, and testicular cancer. She has a background in health services research and biostatistics with particular interest in patient-centered outcomes research, risk stratification, and quality of care for invasive bladder cancer. Also speaking today is Dr. John Gore, who is Associate Professor of Urology at the University of Washington School of Medicine. He completed his residency and fellowship at UCLA David Geffen School of Medicine. He's clinically trained in urology and fellowship trained in health services research. His research focuses on studying issues of access to care and quality of care for patients with prostate and bladder cancer. Now I will turn over control to Dr. Smith.
So we're going to be talking about this patient survey network. John is going to get us started, and then I'll take over from there, and then we'll have questions, time for questions at the end, which we can answer. And so John, you can take it away.
So, hi everyone, and thank you for calling into the webinar. I was going to start with a brief overview of the award that is supporting this work. And then how BCAN was integrally involved in the genesis of the idea, and then also in the proposal that is funding the Patient Survey Network. The award that's funding this is from a relatively new agency called the Patient-Centered Outcomes Research Institute. And they have this category of awards called engagement awards. And the idea is for researchers and organizations to partner to benefit patients in some way. And so whether it's facilitating increased capacity for organizations to participate in research efforts, or to use that partnership to gain knowledge about the things that are important and interesting to patients. And that's really the category that this project applies to. Basically, this category of ideas is about how users interact with healthcare information, and for us, identifying research questions that are important and critical to patients. So a little bit about the role of Dr. Smith and myself as members of the BCAN think tank. We're part of a work group at the think tank called the Patient-Centered Outcomes and Policy Work Group. And it's a multi-stakeholder group that includes researchers and clinicians. It also includes patients, caregivers, nurses, social workers, participants from industry. And actually this idea originated in one of these meetings, the idea of harnessing this really engaged group of patients on the BCAN Inspire website to learn from those patients. And so that same work group is going to be applied in this effort as sort of a multi-stakeholder steering committee, ensuring that we're engaging a variety of perspectives as we move forward with development and also implementation of the patient survey network. So I'm going to hand it over to Dr. Smith to talk about some of the details of the project effort.
Great, thanks. So this is just a brief overview of the work plan, what we developed, and I'm going to go through this in detail. I'm actually going to go through it twice because I think it can get confusing. There are several parts to this effort, and I'll explain why we have these various parts. But essentially, we have three aims. What we want to do is we want to recruit users to participate in this patient survey network so that we have patients and caregivers who we can call on to ask which research questions are important to them. Then we want to generate a list of important research questions and prioritize them with the ultimate goal to create this sustainable method to make sure that we have research questions that are prioritized we can give to funding agencies, and to make sure that the research questions that we're asking are questions that are important to essentially you as a patient or caregiver of someone with bladder cancer. So what have we done so far? Well, we started, the award was provided to us in December, and so we've began work on it. The first thing we did was meet with our stakeholder group because we wanted to make sure everybody was on board with our work plan. At that meeting, we discussed the aims, and a few things that several folks brought up was geographic reach. It was really important for us to ensure that everyone who wanted to participate could. And so we initially were going to reach out to BCAN chapters, but realizing that BCAN chapters aren't everywhere in the United States, we also expanded our reach to academic centers and other bladder cancer treatment centers in the hopes of getting a more all-encompassing group of patients and caregivers. And so we now have started creation of the Patient Survey Network, which is ongoing, and in doing so, we are recruiting users first from the BCAN Inspire website. That doesn't mean you have to be a part of that website to be a participant in the Patient Survey Network, but that's where we began our advertisement. And as of today, we have about 500 individuals who are now part of the Patient Survey Network, which I think is a really great number. We're hoping to aim for higher if we can, and certainly we want, if you're not involved, we would love for you to be involved. We send some advertisements to BCAN chapters, the academic centers we mentioned, some bladder cancer treatment centers. I also put on a blog post on the BCAN site, which is archived. You can read that as well. That has more of a description of what we're doing. We also created a logo, which you can see in the bottom right-hand corner of your screen, to help identify the Patient Survey Network for the future. And I want to speak just a little bit about the survey system that we're using. We're using a confidential electronic data capture system. It's called REDCap. It has several functionalities that can be useful here. One, it maintains confidentiality. All the email addresses of people in the Patient Survey Network will be stored there so that we can eliminate redundant surveys as well. So I know we've all been there where we have surveys that are sent and it says, if you have not responded, please respond. We will only send it out if you have not responded. And we also have the ability to allow you to opt out. And I think most importantly, allows the network to grow annually so that we hope these numbers will just continue to increase so that we just have a really good representation of patients and caregivers' viewpoints here. So after we create this Patient Survey Network, we're going to send out probably 2 more pings to the online community to those who haven't yet responded. And after we have created this survey network, which by the way is ongoing, so if you want to sign up months from now, that's completely fine. It's a rolling, sort of a rolling admission. But once we do that, we're going to evaluate demographics. So we're going to look at how many men, women, race, disease types, because the questions that we're asking in this first survey are very just general questions. What kind of disease have you had? Was it non-muscle invasive, muscle invasive, or what kind of disease did your loved one have? The goal is to include all viewpoints, so we're going to take a look at that, and if there are some groups that are underrepresented, we're going to target those groups with advertisement so that we can try to get a good, accurate representation of the entire bladder cancer patient population. So once we do that, we're going to then start working on generating research questions. And many of you may be aware of the Bladder Cancer Annual Think Tank, where a number of key stakeholders in the bladder cancer community come together once a year to discuss research and ongoing activities within the bladder cancer community, and that's going to include researchers and providers and of course patients and patient advocates and caregivers, etc. And so what we're going to do is start with the think tank members and ask them to rank prioritize research questions. So we're going to ask them to give us their top 3 questions, and then we'll have them rank it. Those questions are fed back to the stakeholder group, who is going to select the top 3 to deliver to you as patients and caregivers, and then we'll ask you to rank prioritize those 3 questions and also list and rank your own. And I'm going to go through this one more time because I know this can get confusing with all the different steps. But I want to just mention that the focus here is going to be on comparative effectiveness research questions. And the reason that we're doing this is PCORI, who is, again, funding this endeavor, they focus on comparative effectiveness research. And the reason is that patients need essentially the best possible information about treatment choices. So comparative effectiveness research compares healthcare interventions to determine which work best, weighs benefits and harms, and tries to figure out what works best for you. So CER provides that information about treatment, diagnosis, prevention, sort of like when you're going out to buy a car. When you're trying to decide which car is better, maybe you're looking at safety ratings, but also fuel efficiency. And without having that information, it's hard to make a good, educated decision. But when you do have the information, you can make a better informed decision, and you can participate in decision-making with your provider, which is important. It also will offer information about how treatment might affect you, because we know every patient's different. There's different medical history, different values, etc. So we're going to focus on comparative effectiveness research questions with this project. So once we obtain those questions, we're going to get the questions that you rank. We're going to compile them within our stakeholder group and organize them, and then we're going to give them to the stakeholder group to discuss and then rank prioritize those to come up with the top 15 questions that we want to deliver to funding agencies. So the whole point of this is to alert basically funding agencies like the NIH, the American Cancer Society, telling them which research questions are important to patients and caregivers, with the hopes that they will use what we provide them with some emphasis on funding those particular questions. And in the future, I think that it also has benefit for us to collaborate as researchers so that we can maybe even through the think tank come together and answer some of the questions that you as patients pose to us. So that's that in a nutshell. I'm going to go through it one more time. I organized it 2 different ways because I know it can get confusing. This way I'm going to organize it by who's doing what, and I'll go through it one last time, and then we'll open it up for questions. So again, the very first step after we're creating the patient survey network, we're going to ask the think tank members, we're going to send them out a survey essentially in August when we have our think tank. We're going to ask them to list their top 3 research questions most important to the bladder cancer community. And then once we compile those, we'll list all of the questions, send out a second survey, and ask the members to rank the importance of these. The top 15 questions that come out of that are then going to be going to the stakeholder group, and that's the group that John was talking about at the beginning of this webinar. And at that point, we're going to discuss the priority of each of the questions, and then each stakeholder individually. So we have patients, we have caregivers, we have nurses, we have surgeons, we have medical oncologists, all in this group, including payers and industry. We're going to ask them to individually rank prioritize the top 15 questions. And then the top 3 questions are what we're going to give to you. And the patient survey network is going to give you're going to get those 3 questions, and you're going to be asked to rank them. Now, if you have questions yourself that you think, okay, these 3 questions that the stakeholder group gave us, I don't think they're important. I think the questions that I have are important. You can say, let's say, put your question in, rank that first, and perhaps rank the other 3 questions second, third, and fourth. So it's really up to you on ranking what you have, and then we're going to take all of that information, we're going to compile it and sort it, and then deliver it back to the stakeholder group. So we're going to take those top questions, talk about it again, rank, prioritize again, to deliver this final product to funding agencies. And so that's the project, and we're doing this once this year as a cycle, and we're going to do this basically annually. We're going to do it again next year, hopefully improving upon things that we learn this first go around, and to make this something that we do every year, so that we can continue addressing the questions that matter to you, and we know that's going to change over time. So how can you get involved? Well, the main way is to respond to the email sent through Inspire, or if you're not on Inspire, you can actually go to the BCAN homepage and you can click on the Patient Survey Network link, and that's going to take you to a questionnaire that you can sign up for the Patient Survey Network. Again, you can sign up at any point, but in August, that's when we're going to send this second link to a survey to those who did sign up, and that's going to ask you to rank the questions and include questions of your own. So we'll take questions now, but if we don't answer any questions that you have in the future, you can also call the number on the screen, or you can email at psn@beacon.org in the future. So I'll let Vanessa open it up for questions.
Yeah, well, thanks so much, Dr. Smith and Dr. Gore. For everyone who's on the webinar, if you have questions, please type them into the Q&A box right now, and also try to keep them, I guess, relevant to this specific topic of the Patient Survey Network. So for the first question, can I still participate even if I'm going through remission? Dr. Gore, can you respond to this one?
Yeah, absolutely. So that's a great question. We're inviting, perspectives from all people, essentially at any point in their bladder cancer trajectory. And so the idea is not to be exclusive and focus on just a specific population of patients. The idea is to be as inclusive as possible and gather perspectives from men and women at all stages of bladder cancer and all sort of positions in their bladder cancer treatment trajectory.
Thanks. For the next question, will the survey additionally focus on issues after surgery? Dr. Smith, can you respond to this?
Absolutely. I mean, the whole goal is for you to ask questions that matter to you. So if the questions that matter to you are questions that focus on post-cystectomy, post-surgery outcomes, then you should ask those questions. Absolutely. It can be, again, any question, any type of bladder cancer treatment, whether it's before, after, during, anything that matters to you. This is the time and the place for you to speak up, and don't be afraid to ask the question that matters to you.
Great, thank you. For the next question, should groups answer surveys en masse or individually? This person said that they have a group of 5 bladder cancer survivors who all have urostomies. Dr. Gore, can you respond to this?
Yeah, so I don't think we have a specified concept of how we would want to do that, but my perspective would be I would rather gather the 5 individual perspectives for the 5 people who are in that group, because even though you guys maybe have similar positions in terms of your bladder cancer treatment and your bladder cancer history, you may have different perspectives on how you got to that point, even if they're subtle. And so we would appreciate those 5 individual perspectives rather than a group perspective.
Okay. For the next question, if we are on this webinar, are we automatically entered into the Patient Survey Network? That's a good question. I guess I can respond to that. Not necessarily. If you've completed the survey, then you'll be in the system. If you're interested and you have not completed the survey yet, you can email us at psn@beacon.org or call the Beacon office, and we can make sure that you get connected. Unless, is there anything that you guys want to add to that?
I will add, and I meant to say this before, of course, if you're on a webinar, you probably have some tech savvy. But if you know somebody who doesn't have access to the internet or is unable to use email or whatever, we do have a way to do this for those people, patients or caregivers as well. And you can actually have them call the number, and they can actually give Vanessa or one of us their information, and we can enter that information for them. And we can also send out some paper questionnaires so they can send it back to us. So we again don't want to be exclusive to only those who have access to internet, and this is one way to allow other people who don't have that access to participate.
Great, thanks so much. For the next question, can my caregiver fill out the surveys for me? Dr. Gore, can you respond to this one?
Absolutely. So I think one of the things that we really want to capture are not just patient perspectives, but also caregiver perspectives. So if your caregiver is filling it out on your behalf because of an inability to fill it out, I think that is a great way to still gather your perspective. Sometimes caregivers have different perspectives than patients, and I think those two perspectives might be exceptionally valuable. So if possible, I would even have both the patient and the caregiver separately fill out entries into the survey network.
Thank you. For the next question, how much influence will this have on future research? Dr. Smith, can you address this question?
Yeah, well, our hope is that it has a great impact. PCORI's mission is, their whole motto is research done differently. I think traditionally research has been conducted where a researcher who has good intentions, of course, think about research questions that they think is important to the community that they're serving. And perhaps many of those research questions are, but the problem is that some aren't. They're not really vetted by patients. And so we may be wasting research dollars on research questions that you may not even care about. So I think that this is one move and one step in the right direction to make sure that we are basically putting money where it matters, where we're putting funding dollars to questions that matter to you. And so I think it has a potential for a big impact on research, and the very first step is something like this, where we start from the ground up, identify the questions that matter, and then move from there.
Okay, thank you. For the next question, will my name and identity be released during the study? I think you might have touched on this a little bit, but Dr. Gore, can you respond to this?
Yeah, the answer is absolutely not. So this is research prioritization. So even though it's possible there could be manuscripts that emanate from this, this is intended to identify research questions that are important to patients. Everything that we summarize as part of this is going to be summarized in aggregate. And so the only reason we would maintain your personal information is to be able to contact you in the future. And you can opt out at any time. And so your information is part of a large pool of patients and caregivers and other stakeholders that are contributing information, but that's really the only sense in that your personal information would be shared as part of a large group whose responses were summarized.
And I'll just add that that's why we are using this REDCap system. We're taking that confidentiality very seriously. So REDCap is what we actually use for research, for confidentiality for research. And I want to just point out that this technically is not research. And I had that question. I think someone wrote me on Twitter about whether this is actually we're doing research here. And the answer is really no. Truly, we're not doing research. We're just gathering information that's important to you. Now, will it lead to research? Yes, I hope so. But it in and of itself is not research. In the survey, when you sign up, we do have a question in there just to make it clear. If you want to be involved in research in the future through the Bladder Cancer Think Tank, so forth, you can say yes to that question. If you say no, that has no bearing on being in this particular project. Like again, when what I said before is this is not research. So what I'm getting at is you have the ability to join some research studies in the future if you want to say yes. If you say no, you can still participate in this patient survey network. And if you have questions about that, I'd be happy to answer them.
Okay, thanks. For the next question, what if my cancer state changes during the study? Dr. Smith, can you address this one?
Sure. So if it changes, again, we're going to be doing this annually, so we will send another survey out, sort of like the entrance survey that you would get if you're, I don't know if you've been on or have you signed up for the PSN yet, but whenever you do, there's a question about, if you're, what your stage of disease is, et cetera, and we'll send that annually so that you can update that if something changes. So if it does change, we will get that information on the next iteration. So, but a good question.
Great. Well, it looks like that's all the questions that we have for now. So I'd just like to say thank you very much to both of our speakers, Dr. Angela Smith and Dr. John Gore. And if you do have questions, please feel free to contact Beacon in the email address psn@beacon.org or call our phone number. Also, the webinar report should be available pretty soon on the Beacon website. So thank you very much, and have a great rest of your day.
Thank you.
And thank you to everyone that participated online.
Thank you.